Autoimmune disease. Following are the few examples of autoimmune diseases. Cancer research suggests an overall correlation between autoimmune diseases and cancer, in that having an autoimmune disease increases the risk or likelihood of developing certain cancers. Autoimmune diseases cause inflammation through a variety of mechanisms. However, the way in which inflammation is created does not greatly influence cancer risk. Rather, the cancer risk is largely dependent on the fact that all autoimmune diseases increase chronic inflammation, which has been linked to cancer. Below are some autoimmune diseases most commonly linked to cancer, including celiac disease, inflammatory bowel disease, Crohn's disease and ulcerative colitis, multiple sclerosis, rheumatoid arthritis, and systemic lupus erythematosus. 10. Celiac disease. Celiac disease presents the strongest associations to gastrointestinal and lymphoproliferative cancers. In celiac disease, the autoimmune reaction is caused by the body's loss of immune tolerance to ingested gluten, found primarily in wheat, barley, and rye. This explains the increased risk of gastrointestinal cancers, as the gastrointestinal tract includes the esophagus, stomach, small intestine, large intestine, rectum, and anus, all areas that the ingested gluten would traverse in digestion. The incidence of gastrointestinal cancer can be partially reduced or eliminated if a patient removes gluten from their diet. Additionally, celiac disease is correlated with lymphoproliferative cancers. Inflammatory bowel disease. Inflammatory bowel disease is associated with cancers of the gastrointestinal tract and some lymphoproliferative cancers. Inflammatory bowel disease (IBD) can be further categorized as Crohn's disease or ulcerative colitis. In both cases, individuals with IBD lose immune tolerance for normal bacteria present in the gut microbiome. In this case, the immune system attacks the bacteria and induces chronic inflammation, which has been linked to increased cancer risk. Multiple sclerosis. Multiple sclerosis is associated with decreased risk of cancer overall, but an increased risk of central nervous system cancer, primarily in the brain. Multiple sclerosis is a neurodegenerative disease in which T cells, a specific type of immune cells, attack the important myelin sheath in brain neurons. This reduces the nervous system function, creating inflammation and subsequent cancer of the brain. Rheumatoid arthritis. Rheumatoid arthritis presents mild, yet significant associations with focal cancers all throughout the body as well as lymphoproliferative cancers. In rheumatoid arthritis, cells that make up the body's joints and cartilages become invasive and induce local inflammation. Additionally, the chronic inflammation and overactivation of the immune system creates an environment that favors further malignant transformation of other cells. This can explain the associations to cancer of the lungs and skin as well as the increased risk of other hematologic cancers, none of which are directly affected by the inflammation of joints. Systemic lupus erythematosus. Systemic lupus erythematosus is associated with focal cancers throughout the body and lymphoproliferative cancers. Systemic lupus erythematosus affects multiple organ systems and is characterized by a widespread loss of immune tolerance. The chronic inflammation throughout the entire body promotes the malignant transformation of other cells, which contributes to the increased risk of systemic and lymphoproliferative cancers. Conversely, systemic lupus erythematosus is correlated with a decrease in some cancers. This is best explained by increased immunosurveillance in these areas. However, the mechanism for why these areas experience lower incidence is poorly understood. Aplastic anemia. In aplastic anemia, the body fails to produce blood cells in sufficient numbers. Blood cells are produced in the bone marrow by stem cells that reside there. Aplastic anemia causes a deficiency of all blood cell types: red blood cells, white blood cells, and platelets.